Hello, my dear friends. Dr. Amit Lall once again this side. Many of you have been messaging me on all possible portals regarding scope of each MDS specialty or branch to be like dictated once again as per 2026 trends. So, my dear, let us start with the most favorite and the messages which have the maximum number is related to prosthodontics. See, prosto probably is one of the oldest branch in dentistry and will always remain the evergreen branch of dentistry. As long as people are alive, they will always go for replacement of missing tooth or missing teeth. So that is why it is everywhere. It's like globally accepted branch of dentistry. Prosto people, I always believe they are the specialized in restoring the lost tooth plus maintaining the occlusion, and to some extent you can say there are wings attached towards ceramics, so go into the level of aesthetics as well. You remember one thing, this is one branch which is has global presence, so even if you want to move out of India after your MDS, no matter your degree won't be recognized immediately, but your work will be recognized any day. I'll just give you an example. If suppose somebody does MDS in prosthodontics in India, after 5 years you have an opportunity or you have change of plans, you want to move abroad, your MDS prosto is not recognized in many developed countries, but the skill which you have is very well recognized. You can always practice good crown preps, good you can say occlusions, good aesthetics. Everybody will appreciate that. Secondly, in India, prosto is taken up very differently when we see about undergraduate and postgraduate training. Okay, but once you pass out, hardly anybody is making cast partial dentures. Nowadays bridges are also undermined because of extent of implant, so there is a lot of scope. Prosto is one branch which had been evolving since years, and with the advent of implants and implant prosthodontics, implant occlusion separately as an entity nowadays, the scope is phenomenal. Plus the world of ceramics is expanding like anything. So anybody who wants to do prosto should have two or three basic traits. Number one, you should be, you can say, ready for a lot of hard work. Number two, you should be a person who is willing to repeat the work again and again without frustration. Thirdly, if anybody has a good hand, good drawing, good carving and all, you should end up taking prosto, no nothing else. Okay, because this will pay you maximally, because prosto person is one guy who will get a lot of consultations. There is a myth which I will bring into your notice. You roam around any clinic or many clinics around yourself, around your city, around your locality, people are doing the worst, you can say, the procedures which are being done are in the branch of prosto. So if you are a good well trained prosthodontics, you can eat up the work of all the surroundings very easily, plus you will get a lot of opportunity for consultations. Secondly, the prosto guy is very enabled enough to run his or her own practice. The question again comes, prosto, after prosto I won't be able to do endo, I won't be able to do RCT. This is one generic question which everybody poses, that after doing MDS in prosthodontics, I will be never good in RCT. Yes, you won't be good in RCT, but why you are worried about RCT? Hire a trained BDS professional who is good in RCT for your clinic, or if your spouse or whatever you feel, or collaborative person or associate dentist in your practice is trained in RCT, that will serve the purpose. You focus on the area of your expertise, that is prosto, occlusion, aesthetics, ceramics, implants, whatnot. So my dear, prosto I always have been rating as the number one branch when it comes to money making after MDS. I haven't seen a good prosthodontist not making or not minting money in dentistry in last 20 years in my profession. Okay, so all the very best for all those who will end up taking prosto. Don't be afraid of hard work. Prosto is like 3 years you will be slogging. No extent of, you can say the slogging is a very minimal word, but once you pass out, the life will be different. You won't be doing the same things what you will be doing in the 3 years in the MDS college. So all the best again. Congratulations to all those who will end up becoming great prosthodontists. Have a great day.